So excited to be here. I know I say that every week, and I mean it every week because I have been blessed to get to know some of the most amazing veterinarians across the country. Tonight, we have Dr. Robin Canizero, who is a holistic homeopathic veterinarian out of Florida. Dr. Canizero, welcome.
Thank you so much for having me. I really appreciate it, Carrie. I love doing these podcasts with you.
I am doing these kind of introductions quick, but there's so much I could talk about, Dr. Canizero, to you guys. But I know that sometimes a lot of questions come in. So I feel like let's kind of get through that and then we can do this. But while I have you, and since there aren't any questions up right now, I just want you all to know, those of you who are listening, that you can feel very comfortable asking questions to Dr. Canizero because she is so good at explaining in complete detail that you could practically leave and do surgery on your pet. Not that you would, but she's very good at making you feel comfortable and knowing what you're doing. So please feel free to ask questions, but it's very important that I say this at the beginning of every show too. The veterinarians that I recommend are recommended because they are holistic. Some of them are holistic and homeopathic, like Dr. Canizero. And when I say holistic, I mean holistic. I don't mean I'm a holistic sometimes and then holistic's not this time. And so one of the things I like to do is have our vets explain to you guys what it means to be a truly holistic veterinarian. So Dr. Canizero, can you do that for us a little bit?
Yes, absolutely. I'd be happy to. I think it's incredibly important for listeners and people everywhere to clearly understand the type of veterinarians they're going to. Number one, there's not one that's so much better than another, although I am going to be biased because homeopathic holistic veterinarians are truly the best. And as we go through the podcast, hopefully that will become clearer. But there are a lot of veterinary offices that are either converting to or opening up as considering themselves holistic, and it is a misnomer because they're really allopathic or traditional veterinarians that offer some holistic modalities. What's important to understand about that is that their mode of thinking, practicing, reaching for medications is going to be first and foremost in the drug category. And so it really doesn't make them holistic. In fact, we sort of joke a little bit back and forth about calling them holistic. And they're not bad clinics, they're not bad veterinarians, but you need to understand that you're not going to a truly holistic practice. So if you're looking for a truly holistic practice, it's going to be a practice where the veterinarian uses natural medicine treatments almost exclusively. Now, we all understand if you break a leg or your pet gets in a car accident and gets badly injured, we may need life-saving medications, end of life, or severe advanced diseases like congestive heart failure may require some medications, but your holistic veterinarian is going to moderate those, go to the lowest possible dose, and be using a lot of holistic modalities to try to stabilize and improve the quality of life and hopefully the length of life for your pet. Whereas a traditional vet will go primarily to those drugs, and they may add a little of this or a little of that, but it's not really going to be a focal treatment of the entire case, if hopefully you're all following me. So a homeopathic veterinarian is a type of holistic veterinarian that focuses a lot more on homeopathic medicine, which is an ancient form of medicine and energy type of healing that, in my opinion, is the deepest and the most effective treatment to balance all imbalances of chronic disease. And those chronic diseases can occur in young animals to elderly animals. And there isn't anything homeopathic medicine cannot treat, and often cannot treat better than traditional medicine. And it doesn't mean that we as homeopathic holistic veterinarians can cure every patient and every pet that comes to us. That's not realistic. And some will come as puppies and kittens and foals and calves. I treat everything, or baby birds or whatever, reptiles. I mean, and even I have a lion client, just by the way. But not all of them.
So jealous. Yeah, I told you. I'm so jealous of that.
I know. She had an intractable eye disease that the University of Florida couldn't figure out. And they said, well, she'll just have to live with it. And fortunately, the client decided to see if maybe holistic medicine might help. So she contacted me. And of course, I had asked twice. I said, a lion? And so she did bring her to me the first time, and she has a travel cage, and I have interacted with her, but not, inside the cage, outside, because her person can interact with her inside her cages and enclosures. But she doesn't allow strangers to, which is wise. She is gentle, but she's still a lion. And I think that she's upwards of 15 or 16. Her eye issue, and if you could imagine, medicating a lion's eye is not going to be the easiest thing. And the University of Florida told her to give these penicillin injections, in her butt, 2 times a day or something like that. And I looked at her and I said, well, how easy is that to do? I mean,
Yeah.
I'm sure her lion's tolerant, but penicillin stings. And I kind of imagine that maybe they wouldn't like it very much. Anyway, long story short, I treated her homeopathically, and her eye cleared up completely. And she has since brought some of her other exotic pets to me. I treat her raccoon, and I'm treating one of her cats, domestic cats. So you can rest assured she doesn't have all exotics, but she does have some other exotic critters that I have helped. But McKean is a lot of fun, and she's had an interesting journey with some chronic medicine issues and a mixture back and forth of some allopathic medicine. Some people fall off the wagon a little bit and then rush to do some allopathic medicine and then turn around and regret it some and come back. And she's one of those cases, but I won't go into detail about that. But she is, again, doing very well.
So 2 questions for you. 1, does she feed her lion kibble?
No, she does not. She is always on the hunt for inexpensive meat and bones.
It was interesting to me because
what that food bill is.
Right,
people
but
afford to feed raw.
I've always thought it so interesting that, we wouldn't, even at the zoos, I don't know if you know who Dr. Patton is, Dr. Richard Patton, but he's a bioscientist who develops diets for all sorts of animals, polar bears to lions. He's done it for years. He worked in zoos. And we had spoken about that. And I said, how come, it's so weird to feed our felines a species appropriate diet, but if we go to the zoo, I see them giving them meat. Like, it's just very strange to me. And he said that some of the zoos, he would talk to them and redevelop certain diets. And it's just interesting to me that we can't make that connection.
Well, we are unfortunately a human species that wants convenience and ease and speed, and we like it at no cost.
Yeah,
and I mean no cost, like no financial cost, but we wanted it no cost to the pet. So we expect we could feed kibble. I mean, would you live on pretzels for a living? And people will ask me often, well, how about if it's organic kibble? And I said, well, do you think organic pretzels is any better than non-organic pretzels? Maybe slightly better, but overall really not better. It's still processed food with really no nutrition. And
I saw an organic Reese's peanut butter cup, a candy bar. It said organic, and my friend sent me a picture. He said because those are my favorite. And so he sent me a picture, and he says, you can eat as many as you want now. And so, of course, I was like, well, yeah.
Oh, my. Yeah, I think you would fill up the whole screen. Kind of,
right?
Just the whole screen.
Oh, my God.
So I think that people are getting the idea. If you want your pet healthier, you have to feed real whole food. I mean, it isn't really, it's no different than people. If you live on Hungry Man dinners, maybe I'm dating myself with that descriptor, but if you eat Hungry Man dinners, really expect to be healthy. And if anybody's watched that wonderful documentary, vegan gentleman who decided that he would do an experiment and eat nothing but McDonald's 3 meals a day and nothing else. Anything that he put in his mouth that was liquid or food was McDonald's, and that was it. And he actually had elevated liver and kidney enzymes and got very, very sick. He gained weight. He got fat, logy, unhealthy, throwing up. I mean, it was horrible. And imagine that. Now, maybe not everybody's going to have a reaction like that, but that isn't atypical. That's not weird. It's not unusual. And then we wonder why our pets throw up too much or have digestive upsets or end up in the hospital. Maybe we could even say, and I did a podcast with Carrie, that even feeding crappy diets could be veterinary-induced diseases as well. So
yeah, absolutely. So I'm going to take you back to the lion a little bit because there's something that I wanted to talk about that I just experienced myself over the weekend. So,
yeah.
so I thought will lead into talking about how important, and your lion story and my story, both felines, are perfect examples of how important it is to get your second and third opinions. Because my story is I took my cat, my husband and I were in the garage. I was throwing out trash and we weren't doing anything we weren't supposed to be doing. But my friend was inside and my husband and I were in the garage, and we just heard this horrific sound coming out of one of the kittens. And so we both
Uh-oh.
come rushing in, and we said to my friend, "What happened?" And he said, "I don't know. She was underneath Nevada, my dog. I have a golden retriever." So
Uh-oh.
Nevada's not a big golden. She weighs 47 or 48 pounds. So she's very tiny golden. But now my cat's bleeding from the eye,
Oh boy.
and her face is swollen, and she's sneezing blood, right?
Uh-oh.
So I take her to the emergency room vet, which, by the way, I had to wait in the car. So I don't get to speak to the vet. So they take the cat.
That's
The
scary.
receptionist comes out and asks what happened. I said, "I don't know. I can't find any bite wounds on her. I think possibly my dog stepped on her, maybe broke her nose. I don't know. I just don't know." So they take her, and then they come out and say that they were able to examine, and it looks like she might have a fractured jaw, and that it might have ruptured through because she needs surgery. She needs stitches. She needs surgery. All this stuff, and that it has to be done now. Like, it needs to be done now, according to them. And the bill is going to be $3,000. And I said,
Wow.
"I rather you give her some pain meds, and we'll start her on some antibiotics until I can get her to her vet in the morning."
Oh,
They come back.
girlfriend, you need the antibiotics for trauma.
I wasn't sure because the way they were like making it sound, and the blood coming out of her eye, and I thought, okay, well, we're just going to do one until I can whatever. And so then she comes out and says, "If you don't get into the vet by 8 o'clock in the morning, 9 o'clock at the most, it may be too late to do this because the skin is going to start." I don't even remember what she said because I stopped listening. But my point to all of this is that I get her to her regular vet, and what we find out is that this may have actually been an old injury from 2 months ago, and there was an abscess in there that ruptured. So she's fine. She's absolutely fine. There's no anything. There's nothing. And it cost me $150. So to think that I could have had that cat under anesthesia, going in there, suturing up whatever she was going to suture up. I mean, the kitten wouldn't let me look at all. She was in way too much pain and trauma and all this stuff. But it really, hits home for me, because I know that pet parents don't have the amount of experience that I have to be able to go, she's not, her neurological, she wasn't acting like she couldn't see, her balance was good, her breathing was good, like, I know those signs. But then I hear you talking about this lion who they tell them, "Well, she's just going to have to deal with it. There's nothing we can do for her." The second opinions and third opinions are so, so valuable to us.
Yeah.
And how often do you see that where it's misdiagnosed?
Well, it's actually very common, and I see misdiagnoses a lot. And I don't believe that these are malicious things. I think it is, when you see blood coming from places, I mean, everybody jumps into a panic. I mean, something happened. Probably it was traumatic in origin. I don't know why there was an abscess present, but the degree of pain, usually when the abscess explodes or opens, there's a relief of pain, and there's less pain. And it wouldn't be as likely you'd have blood from the eye and the nose, but maybe a minor amount of trauma had precipitated an older injury and aggravated it. It's difficult to say. But I think that the most important thing is that if you are going to go to an emergency clinic, or you go to your traditional veterinarian, and I want you to really reach out and kind of go with your gut. I mean, if your gut just says, this doesn't feel right, it doesn't feel right, it doesn't feel right, then in most cases, but not every case, most of the cases, the pets don't have a life threatening ailment. We do want to make them comfortable. So I think it's a good idea that your kitty went home with pain medication. Antibiotics were not likely indicated at all. But again, it's like a go to. They seem to do that for any reason whatsoever and want to give antibiotics. I don't even use antibiotics for abscesses. Homeopathic medicine works great. Um, I would advise you, if you have interest in homeopathic medicine, you should begin a relationship with a homeopathic veterinarian, because we can help guide you, and you'll learn so much from us that I'm not going to say you don't have to go to the emergency room, but I would say that probably 50% less of the time are you going to be as inclined to run to the emergency room, because you're going to have some excessive tools available to you that will help guide you in saying, okay, I need to check the gum color, I need to check their temperature, I need to make sure that they're not bleeding out, that they're not so weak they can't stand up. So you're going to get to know like what constitutes a huge emergency. A pet that has vomiting or diarrhea and they are extremely lethargic and they're collapsed on the floor is an emergency. If they have vomiting and diarrhea and they're running around, go grab their stuffy toy and run to the door, wagging their tail, wagging the whole body, but they've got diarrhea and the squirts, I'm not going to say that's not a problem, but it is not the degree of a problem or emergency that the former description would entail, in which case, yeah, rush and go. Misdiagnoses happen all the time. Veterinarians are good at their jobs for the most part, but everybody can miss something. And some cases are not straightforward. There are some cases where you bring your pet in and they have a collection of symptoms that just don't line up with a really good diagnosis. And to help in that vein, a diagnosis is nothing more than a made up box that contains a descriptor of common symptoms for a labeled disease such as diabetes or heart failure or cancer in the mouth, or because that's not even the disease, it's actually a symptom of the disease, and neither is the abscess in your cat's mouth. Because most cats, if they have a trauma, a jaw fracture, and it seems to heal okay on its own, they shouldn't go on to develop an abscess. And so the question is, well, why? Why did they develop an abscess? Well, there was something that energetically your kitty wasn't able to completely heal and completely resolve that trauma or issue or whatever caused the initial trauma to the mouth of the jaw area, in which it could more easily be re-injured, and or that an abscess could be present, because an abscess isn't going to form that fast. So in other words,
let me back up a little. Well, so after I spoke with the second vet, my vet, and she called me and gave me her diagnosis, she said, did somebody bite her, a couple months ago, or she knows I have all 3 kittens and 2 dogs. So she's like, are the kittens playing with each other roughly? Could there have been an old bite wound that formed inside the abscess? And at first I said no. And then later I remembered when she first started exploring the dogs, Nevada gave her a warning, and actually did, on that side of the face, left a little mark right exactly at the same spot where she now says the abscess was. So I think that's what ended up happening. But I will say this, it's interesting because sometimes I'm upset because, like, for example, I couldn't go in to talk to this veterinarian, which I still think would have been better. But then again, I also think that me saying, I don't know, maybe my dog stepped on her, also led to the misdiagnosis, right? Because then now she's got it in her head that this giant golden retriever, because I didn't get a chance to say that.
We shouldn't. And I want to go back to what you said, because I think it's important for your listeners. We think an awful lot of, well, if a cat gets a puncture wound, they're going to get an abscess. That actually is a chronic disease symptom when they develop an abscess, because a puncture wound should just drain and heal and not form an abscess. So when cats form an abscess, it's a symptom of underlying imbalance of chronic disease and can be treated homeopathically. So they should not develop an abscess just because they've had a bite wound. But I do understand that in allopathic medicine, and when I was in veterinary school, they said, oh, yeah, cats get abscesses after bite wounds. And so you put all this together and you say, okay, every bite wound is going to be an abscess, or it's going to be infected, or I have to use antibiotics. And it's really interesting because I think that I ran into a vet one time that didn't use antibiotics for abscesses. There was as good or better healing absent the antibiotics for abscesses in cats than the use of antibiotics. And then, of course, I treat homeopathically, so that healing is accelerated, tends to go well, and you don't see a recurrence. Because in your case, your cat could have a recurrence because antibiotics will not solve the underlying imbalance. It may suppress or the abscess for the time being, but it may reform in the future. And then worst case scenario, and I don't mean to say this to scare you, if it continues to go unresolved, then you might have cancer of the jaw or the localized area if it doesn't ever get resolved. And what I mean by that is assuming antibiotics, people ought to say, oh, okay, well, the abscess went away, so that it was cured. Not necessarily. If there's always a festery place there, or if another disease takes its place somewhere else, maybe the ear infection on that side, it's literally the same disease. It's the same imbalance. It's manifesting differently because it's no longer allowed, because of the use of the antibiotics, to manifest at that same location. If the patient is very strong and vital and you suppress a symptom, the symptom will come back generally in the same place. And that includes tumors if they've been cut off. So, but the more you cut them off.
She's so darn young. She's not even, she's so young, and I'm like concerned, like what's going on. You're right. Like why wouldn't that original bite wound heal on its own? Is interesting to me. Like why and the weird part is I never even knew it was there. It wasn't like she wasn't eating
and it wasn't a really big thing that, like you said, stopped her from eating, got a big swelling, something where you said, oh my gosh, this is a really bad injury, and you nursed it. And then she developed an abscess later on. Both scenarios would still be a chronic disease progression. It's just really interesting that a milder trauma had produced such a big response, but I'm still suspicious she sustained some kind of trauma, whether she was stepped on or flung and, hit something and I'm not saying there wasn't abscess there, but because of the blood from the eyes and the nose, I would only expect to see blood coming from the mouth, maybe if the abscess ruptured internally in the mouth or on the external of wherever the abscess was.
Not definitely the eye and the nose.
Yeah, on the same side.
Same. Well, the nose, it was coming out. She would like sneeze it out. So both nostrils.
Both nostrils.
Yeah,
was
both nostrils. Eyes? It was only the eye where the abscess was, or where whatever was.
It would be an interesting case to work up because I think there still might have been a traumatic precipitous to this festering problem that didn't resolve itself. It may always be a mystery because you weren't there to see it.
I know. One thing I'm always gonna know is that she definitely was entangled, because my friend saw. He's like, I don't know. They were over there, and then Nevada was standing, so it wasn't like she was laying down on her. Yeah. So I'm probably never gonna know.
Gone to correct the kitten, and of course she's bigger, even though she's only 47 pounds. That's still a significant weight advantage. Sure. And if she went to correct her, she may not have meant to hurt her. But, again, if she's like, cut it out, boom, cut it out, stop doing that. I mean, there's always that possibility. And when you don't see it happen, it's hard to know. I'm treating a case now that's really interesting in a little Pomeranian that was diagnosed with fluid in the heart sac, fluid in the lungs, which was between the lung cavity and the ribs, which is a pretty bad place to have fluid, and then fluid in the belly. And the reason I bring this case up is because nobody understands really why that happened. And she didn't go through all the diagnostic testing that was recommended. Some fluid was withdrawn. She's not out of the woods yet, but she's responding really well to homeopathy. And of course, her breathing was very difficult. So if you have fluid around the heart, it's pretty dangerous. But what is interesting about this case is the client kept asking me, and this is where it's so important to listen to your clients. She said to me, a month or two prior, she said, this big dog went after her and rolled her. She didn't seem like she was hurt, but I was wondering if that could, and then, if that could have precipitated this. And it could have, in the sense that it could have been a stressor. I'm not 100% convinced that it caused a trauma that caused all the fluid buildup, so we don't know the actual diagnosis. And she was so bad and so seriously ill that honest, she came to me to put her to sleep, and she was devastated, and she'd lost her husband, and this is her only baby left, and and the thing that bugged me was she was so alert. Her breathing was terrible. Her belly was totally swollen. Her gum color was good. She, walked into my office under her own power. And I said, well, let's just give it a little longer. And I don't always talk people out of euthanasia, but she was such a wreck. And I just thought it doesn't feel right to me. And again, it felt a little bit more intuitive. And maybe that's not good to be as a veterinarian, but I think it's really all right. And that was about 2 months ago that we were considering putting her to sleep. So she is, her belly swelling went down and it's gone back up again. So we're struggling again a little bit to try to figure out the next best remedy. But it's important to listen, because in the back of my mind, same thing as when you go and speak to the other vet, you don't want to be absolutely streamlined and saying it's got to have to do with trauma, because then I might not find the right homeopathic medicine, and your allopath may go down the wrong path and go, oh, it's a broken jaw, this, and surgery is necessary, when it may or may not be necessary. But it is also important to keep those things in mind, because in a case, if we get stuck and the swelling doesn't go down, it might be valid to look at some trauma remedies to say, I just wonder, and which is something I might do in your kitten's case, to go, I wonder if a trauma remedy is indicated here for the stuckness of the patient moving forward, doing really well, and then suddenly not. And she's nowhere near as bad as she was before. Don't get me wrong. Her breathing is normal, but her belly size has gone up significantly. And I have her person measuring her belly circumference so we can keep an eye on how much fluid is there or not there. But I mean, her belly swelling was almost completely gone the prior visit. So, we do need to listen. We do need to pay attention. You do need to get second opinions. If you have the luxury of time to do it, do it. Because if you get talked into a big procedure, it isn't just about the $3,000. Imagine the pain and suffering your kitten would go through for a surgery that had been necessary. And what if you lost her under anesthesia over a surgery she did not need? That is something we just can't take back. So when your vet tells you, your dog needs a dental cleaning, go get another opinion. Some of them just have little staining on the teeth. I mean, why would you put your pet under anesthesia for a little bit of staining just so they don't have pearly whites? There are alternatives to that, but don't just assume.
I had a French bulldog come into the Spaw. This was years ago. His name was Buddha, and it was such a fitting name for him. He was his name was Buddha. But anyway, she took him to a veterinarian, and when she picked him up, they had given them these forms that said different things that their pet needed. And one of them was this list, and on it had pictures of dogs' teeth and what level her dog's teeth were. This, by the way, was a 7-month-old puppy.
Wow.
And when she showed me the thing, she came to me and she's like, what do you think about this? I don't know anything about dogs, but they're saying, and when I looked at the list, they had marked, it had his name on it, and they had marked it off as a level 4, the worst teeth you could possibly imagine. So I said, well, let me look at his teeth. I didn't want to I was pretty sure a 7-month-old puppy is not going to have the worst that they're calling. But I look, of course he had nothing wrong. She was so mad at the vet. And I said, don't be mad. It could have just been an error. Maybe there's another dog named Buddha and they accidentally gave you the wrong thing. But it did make me think, what if she would have booked the dental and instead of them doing the pre-exam, just said, he's here for dental. We already did the exam. Let's put him under. He's a French bulldog. So I'm like, that could have been so tragic had that gone down the road. I don't know what ended up happening. I don't know if she ended up calling them or if she just went to another vet. A lot of people don't like confrontation. So she may have just been angry and not gone back. I don't know. But I remember thinking, wow, that bulldog was under anesthesia.
It's so dangerous. But I think it's important. I want to touch on the dental thing because it's such a big deal, and we lose a lot of animals under anesthesia for dental. I want your listeners to understand that dental disease in animals is ostensibly a gastrointestinal problem. And when you put them under to clean the teeth, It's a Band-Aid approach where you make the teeth look all pretty and then they're going to get nasty again because we didn't fix the underlying reason to have bad gums and bad teeth and loose teeth and, stinky
Absolutely.
breath. And it's a gastrointestinal problem where the flora in the mouth is not appropriate. And so they can have deteriorating disease in the mouth in the same way you might in your intestinal tract, your stomach, or even your colon or rectum. And
So important.
most allopathic veterinarians will never discuss this. They're going to, nope, National Dental Month, let's get your pet in and get all these pearly whites done. It doesn't fix anything. It'll give your pet decent breath for a little while until the growtiness comes back. I had a husky come to me one time and she wanted me to check the dog's mouth. And she told me, and I'm not lying, this was about probably 20 years ago. She told me that her dog 2 weeks ago had a thorough dental cleaning, anesthetic dental cleaning. This dog had the most inflamed gums I had seen and had incredibly rotten, nasty tartar all over the dog's teeth. I don't remember if this was a male or a female. And I said, "Are you sure that so and so got a dental cleaning 2 weeks ago? Are you positive?" No, absolutely. She had the receipt to prove it and the medical records to prove it. So if you think, and not all of these cases, the mouth will go that nasty that quickly. But if you need to have your pet's teeth cleaned on a regular basis, there's something very the matter. And we
Very
can look
wrong.
at diet to help improve that. We can treat homeopathically to improve that. But those, at a minimum, are going to be necessary because something is very the matter. If your pet needs a dental cleaning ever, the only reason to put a pet under anesthesia, in my opinion, for a dental of any kind, is a pet that has a very painful tooth that might be abscessed and is not loose, that needs to be extracted. And it's just inhumane to try to extract. Well, you can't, because the dog's not going to say, "Let me hold my mouth open while you just ream the heck out of my mouth." Those are pretty much the only reasons. There's no other reason to put them under anesthesia for a dental, in my opinion.
I agree.
There are circumstances where I might go ahead and acquiesce, and we can go into that if you have questions or interest in that. But I think that's important. This is a gastrointestinal problem. It is not a mouth problem.
So I have a veterinarian that comes into my place twice a month, and we do non-anesthesia dental cleanings. And then we have a huge conversation after the fact. Coco, hi, welcome. Give me 1 second. Let me finish this thought. Where we have this huge conversation after the fact that says that we don't want you back. This is what we do to prevent this. Let's start with prevention. I am really surprised at how many people don't go down that road. And then they will call me 3 months later and say, "I don't think you guys did a good enough job. His teeth are rotten again." And I'm like, "Wait a second. I tried to tell you."
Yeah.
And so I fight it all the time. And people scare people into doing the non-anesthesia. They don't want you to, like veterinarians have told my clients, "Oh my gosh, it's so dangerous to do the non-anesthesia teeth cleaning."
Really?
Yeah. I had a vet tell one of my clients one time that, the tools we use to clean their teeth, and how if the dog moves, they're going to jam the tool and it can go up into their navel cavity. And I mean, you name it. It just scared the to death. And I
I've
didn't want
never seen that happen. I do
never
a
have
hair dental too.
Yeah.
But it's another Band-Aid approach, but at least it's not as invasive as anesthetizing the pet. And I've never heard of a technician or a circus like at your facility, myself included. I've never had an experience where the instrument, jammed up and went all the way through the palate or into the sinus cavities. Now, I have seen where the upper canine teeth have been extracted, and then there's a fistula. There's a communication between the nasal cavity and the oral cavity, and that's a huge problem. That's not always the vet's fault. If there's so much rot up in there, then bone and all the tissues will rot away, and you could get a communication. So oral health is a digestive problem, and if we don't treat it as such, then, and it doesn't mean you have to feed raw diet. There are some alternatives. There's things we could talk about if you want to about that. But we have to feed whole, real food, period. I mean, you're just not going to get it done with kibble, freeze dried. You're not going to get it done. Freeze dried's okay if you're traveling for a very short period of time and you just need something to tide over. But people often think, "Oh, but it says raw." Raw is raw, period. It is not freeze dried is freeze dried. It's not raw. It might have
Yeah.
been raw at one time in its existence, but it is no longer raw. Or raw
Yeah.
kibble. That's always another one of my favorite ones. It says on the
The
back, oh no,
what do they call it? Robble or something. They have some name for it now.
I
It's
have
like,
no idea. Well, they'll try anything to make it, appealing. And dry food's cheapest to sell, and it's cheapest to ship. Canned food is expensive, and whole food weighs a lot. But you probably have a question, so
yeah. So Coco, welcome. So she says her bully does a lot of air licking. This is common. We see this happen, and I know a lot of people have the same complaint. Coco, she's raw fed, so her teeth look great. Do you think this could be a stomach issue? Vets scratching their head. Vets are scratching their head. No one can figure out why she's air licking.
Air
What do you think?
licking can occur for a number of reasons, and certainly digestive problems can be one of them. Air licking sometimes also could be a neurologic or an anxiety reaction. Pets that obsessively lick are trying to release endorphins. Air licking may release endorphins. I don't know if they've done specific studies on that. I would certainly look at the diet. The thing that's difficult is that there's a lot of raw food diets out there, and they all call themselves balanced and perfectly healthy. Some of them are and some of them are not. And understand that the higher we eat on the food chain, which means meats, if you eat meat, you're eating the highest on the food chain and ingesting the highest amount of genetically modified organisms, and that is damaging to the gut. So we're not always doing the best by feeding raw meat diets, and they
Right.
also may not be well balanced. So I would definitely work with somebody that could have a look at the diet, and then know too that air licking clothing, licking the floor, any of these things are very treatable homeopathically, because there's no drug for it. And if vets don't have a drug for it, they scratch their head and say, I have no idea. Unless you're a homeopathic veterinarian, there is nothing foreign to us. There is nothing weird. We look for interesting, peculiar symptoms to help guide us to choose the right natural medicine that has no side effects to treat what ails them. And I presume there's probably more symptoms than just the air licking. And it doesn't mean that they're all digestive symptoms. There may be some symptoms in other spheres, maybe too much licking or itching, or maybe too much drinking of water, maybe vomiting or regurgitating, or maybe soft bowel movements, maybe some skin issues. So there could be a variety, or maybe some mental and emotional issues, some anxiety issues. And so
Yeah.
I'd explore the case thoroughly as a homeopath to look mentally, emotionally, and physically, to see where that individual is at, in order to determine what's the most likely targeted area that we might be dealing with. Is it mental and emotional? Is it obsessive compulsive? Is it a seizure like disorder? Is it a digestive issue? And then, work the case up thoroughly to see what homeopathic medicine looks like it's a best fit. So I hope that I've helped to answer her question.
Yeah. So like the timing of when your dog is air licking, is it all like, is it like you're saying, like after they eat, during, before they eat, all of those kind of things? There's so many. And like you said about, there's probably other symptoms that we don't link together. Like I've seen that a lot where people are like, oh, those two things are connected. And I'm like, yeah, probably. They're probably connected. It seems
Yeah.
off. I
I
just had
think
a,
Coco is saying that she's a little OCD. So that would make
OCD.
a lot of sense. And because if they are, well, and honest to God, I've treated dogs that I would consider autistic. And they're very interesting to treat. They respond very well to homeopathic medicine. Dogs that are OCD often have some kind of anxiety disorders. And it
Yeah.
could be both an anxiety and digestive issue, both together, but seeing where those symptoms lie together, what peculiar things go along with that, helps me as a homeopath to better understand the case.
Yeah.
Like you're getting the food ready and the pet's agitated and anxious for that, and air licking. Well, that's kind of a clear indication that it's associated with excitement, or possibly anxiety, or excited anxiety. And also, as you mentioned, if there's air licking prior to eating, some animals, like some people, cannot feel well on an empty stomach. And dogs can't tell you that. You might say, gosh, my stomach hurts. I need to go get something to eat, but a dog can't really tell you that. So how might they tell you that? by maybe vomiting, regurgitating, air licking, getting anxious, pawing at you, trying to steal your food. There could be a variety of ways that may manifest. So the fact that she claims that maybe her dog has OCD, I generally understand what she's saying about that. That's very treatable homeopathically.
She says it's after dinner, a little after dinner. Still interesting.
Mm-hmm.
Have
Yeah.
you, Dr. Canizer, have you used the animal biome tests at all?
I really haven't.
No.
I've sort of looked at them. I've given it consideration. I don't know. As a homeopath, we treat based on symptoms,
Yeah.
and it's an interesting test. I wouldn't guide my treatment per se. And
Yeah.
since a lot of people, I'm myself included, we use pre and probiotics, and I don't use fecal transplant, but I've had a couple of people that have used them in capsulated fecal transplant kind of methods. I don't know that they're as successful, but that sounds kind of gross. But it's in the microbiome realm of conversation.
Yeah.
But those things can be very effective, and I'm not an expert on fecal transplant, but I have looked at microbiome, and there's no question that we have microbiome disturbances in our pets, and I believe strongly that the refractiveness in treating inflammatory bowel disease and colitis and pancreatises, those used to be a piece of cake for me as a homeopath. I mean, oh gosh, those are so easy. Now it isn't as much, and I suspect that it has to do with glyphosate or genetically modified organisms in foods because they're more refractory to treatment. And not just allopathic treatment, but even to some degree to holistic and homeopathic treatment, that we don't treat them successfully, but I have to be much more clever about it. It used to be easy, oh, we'll put them on a whole food diet, and that's almost the fix I need. But
Yeah.
now I really need more ingenious, like puzzling it out homeopathically to treat these guys, because diet alone, most of the time, does not fix them. And
Yeah,
I
it,
attribute it to that.
it is interesting how we were able to take a lot of these dogs off kibble and see some really good results, but over time we're just doing more and more damage. Because it's interesting, because I was just talking the other day and I was saying, back when I was a vet tech, we had a lot of dogs on kibble. That's all anybody ate was kibble. No one ate whole fresh foods. I mean, maybe they would get table scraps, but which was great, but all of the dogs I saw ate kibble,
Hmm.
and they were they were they were healthier. They were able to actually handle the crappy food. But now that we have all these flea and tick medications and heartworm medications and over vaccinations, and they can't even handle eating the pretzels at all. Like, not that they ever should have been, but it's
Right.
interesting to see the more and more disease coming out of these animals. And Coco, just from me personally, don't give up. Don't give up, because what may seem like, oh, no big deal, she's licking the air, and your other vet's scratching their head and saying, well, whatever, she's licking the air. I wouldn't give up. It could be a precursor to something that you should pay attention.
I wouldn't either. And it isn't even just a matter of precursor. When we ignore early symptoms, then eventually they become greater, bigger, and more dangerous. And especially
Yeah.
if we layer medications upon them. Let's say your vet wants to experiment and put your dog on Flagyl or metronidazole, which has lots of horrible side effects aside from wiping the gut out, because all antibiotics do that. But that certainly is a nasty one. It also can have neurologic side effects. Well, your dog already has an interesting response to after eating and maybe OCD issues. Um, don't give up, because that can morph into something more serious. It could morph into, if it's a gastrointestinal origin, it could morph into a pancreatitis or hemorrhagic gastroenteritis, which is severe bloody bowel movements, etc., where they end up in the hospital. I mean, I don't want to say this to scare you. It's just that chronic diseases don't go away on their own. If we have a
Right.
chronic disease, it will progress. I don't know how quickly, and the more you do, you need to vaccinate and do things like this, it'll get worse faster. If you're using
Right.
flea and tick medications, it'll get worse faster. But like anybody else, there's some people who smoke cigarettes for 90 years and they're still pretty healthy. But the majority of people are not healthy for a very long time at all smoking cigarettes. So that's the
Right.
rarity. And to your point about, yeah, they all ate kibble back then. I mean, it takes time to create enough destruction and disturbance, and that's true of in humans too. And so, over the course of time and generations, we're going to continue to see bigger and bigger breakdowns. And then we use bigger and badder drugs. And the more that we use drugs, the more we give them veterinary induced diseases on top of the original disease that was never fixed by the drug to begin with. And then if we breed those pets, then they will pass those traits on to the puppies, etc. So we have more vaccinations, sometimes more often vaccinating. We have more flea and tick medications. And the flea and tick medications, I mean, back in the day, I hate to date my, I used to get nervous about, like Adam's flea and tick spray. And I thought, oh my God, that seems really toxic. But you look at the medications we're giving now, like, maybe I shouldn't say on the podcast, NexGard and Trifexis and Sympatica. And I mean, those have neurologic side effects, and they also, so they could cause seizures and shaking syndromes, and, that it could cause cancer. I mean, you probably could get cancer flea spray back in the day. That was permethrins and pyrethrins, but that was synthetic pyrethrin, so it wasn't quote unquote as safe. But I used to think, oh, that doesn't smell very good, and I'm not so sure that's a really good idea. But now, the flea and tick medications we use are more scarier. I mean, I thought frontline and advanced, but the new generation of flea and tick medications are much more frightening. And the side come in to see me, or the drug-induced diseases or veterinary-induced diseases that come in to see me are really scary. And some of those I'm able to turn around, and some of them I can only turn around somewhat. And if they have cancer, it's even harder. Yeah. So I don't know. To me, it's like Russian roulette. If you're going to use one of those flea and tick poisons, where is the actual bullet in the chamber? How many times away with using that medication before you get to the bullet in the chamber? And once you get to the bullet, you go, oh no, I want to take that back. I don't want to do that. So I understand fleas and ticks are really annoying. But I would rather have my pet alive and find the natural alternatives to work with and help my pet to be healthier, so they don't attract fleas by proper diet, home treatment, good lifestyle, good exercise, reducing stress. It's things that we would do for ourselves. I would much rather do that than risk that, oh, well, quickly I might get rid of fleas and ticks for a little while until they get resistant to this bad medication, and then they come out with another one. And
they have a new one that's 6 months.
Alive longer and healthier and happier, and I'll deal with the fleas and ticks. So mine don't see any of the flea and tick poisons. And heartworm prevention is something I discuss with my clients, but probably 6 or more of my clients choose not to use heartworm prevention. I'm not telling you not to. Consult with your homeopathic veterinarian. If your pet has a serious illness, I almost universally will take them off of heartworm prevention. It's one more drug that their body cannot handle. It's too much, and it's the benefit. It just doesn't, the risk, it's too risky. I think I said that. Sorry about that. It's been a long day.
I know. I try to, in California, we start this at 4 because a lot of the veterinarians that I recommend are on the East Coast, just like Dr. Canizero, and I don't want to keep her up too late. So I appreciate you coming on. We used to give pyrethrin dips to the dogs that would come in with fleas, because I am aging myself, because when I first started in the vet world, there was no topical flea and tick stuff that you could use. It didn't exist. So the only thing you could do was these flea dips. And we would do, I hope I don't someday end up with lung cancer, because I can't even tell you how many flea and tick baths I did with pyrethrin dip. And, and I just think, oh my God, what were we doing? Like, it's just crazy. It's so sad. So it's just, we're just destroying everything, but we learn, hopefully, and we educate what we learn. And I'm here to tell all of you guys that these vets that I have on here are speaking from experience. They're not, we've watched it happen, and now these flea and tick stuff are coming out. I just had, it was actually through Joey's Legacy, someone had contacted me, just wanted to ask me about flea and tick stuff, and I heard the story that she took her dog to her regular conventional veterinarian. And they were doing a trial on this veterinarian's dogs, patients, to see how they responded to this new flea and tick stuff. It was going to stay in the dog's body for 6 months.
Whoa.
Her dog died. The dog died
like
2 weeks later. And the veterinarian and the drug company are both saying it had nothing to do with the drug. The dog was perfectly healthy, went through it perfectly well, no problem. But what was shocking to me is that a drug that can stay in an animal's body for 6 months, and you're going to do a trial on it? What happens if you can't get that out? You can't get rid of it.
No.
So, but
a case in point here that I don't want your listeners to miss out on is when we talk about trials of any medication, if we're going to dismiss away the possibility that wonderful person's baby passed away 2 weeks after getting this medication and dismiss it away, that pet is not going to go into the statistical data as being any adverse event. And so when your vet tells you how safe all these flea and tick products are, number one, we didn't test it. So how do we know, right? I see the side effects. I see the diseases that come along with these drugs. So I'm not comfortable using them and recommending them. And I don't recommend them to any of my clients under any circumstances. I can think of a single circumstance, honestly, not a single one. But these double-blind studies are not great because they are driven by humans that interpret the data, that decide what goes in, what doesn't go in, what gets reported, what doesn't get reported, what's statistically significant, what isn't statistically significant. And one thing you guys might not know about me, and Carrie might not either, is that I came from a research background before being a veterinarian. And I can tell you 100% sure that in the research facility that I was in, not my investigator that I worked for, but another investigator was falsifying data on heart drugs for humans. So if you think that double-blind studies and scientific studies are a safe bet to tell you whether something is safe or not, they're flawed, and they might even be falsified. And what if that data for that woman's dog is thrown out, which sounds like it was going to be thrown out?
It'll get thrown out. For sure, it'll get thrown out.
Right. But even if they report it and they say, oh, we don't think it was attributed to this, it's still not going to carry the same amount of weight. And understand that if you do give a vaccination, a drug, any medication, and your pet has an adverse event that could occur anywhere from a month, several weeks, a couple of months, 3 months after that medication was given, it doesn't mean the medication had no effect whatsoever. The medication still may be to blame, but the problem is if we don't have an immediate adverse reaction, it's often dismissed by the veterinarian. It's not by me, but by the veterinarian, if they're allopathic, or even by the drug companies, and they get away with it. And it isn't that we have to say that I know for sure after 3 months, after a vaccination, that the vaccine was a for sure thing. But it does mean that, gee, I'm concerned about that. I think I'm not going to repeat that same process because maybe that's not a good idea for this patient. I don't think that the risk is worth it. And why can't we be grown-ups and talk about it this way? Because I've given a rabies vaccine to a client's pet of mine, and her pet went on to get a cruciate ligament tear, not even 2 weeks, 10 days, 2 weeks after I gave the vaccine. Now, I warned her that her dog could get that because her dog already had another cruciate tear that had been surgically repaired, and it was a really bad outcome. And I said, I'm really worried about this vaccination, but it had been so many years, and she was really worried. And she said, I really think I should boost her because they keep chasing wild animals in my yard as a pack, and I'm so worried about it. And I said, okay, as long as you understand. She wasn't angry at me. We discussed it openly together. She came back. It cost her a lot of money. We had to do acupuncture, homeopathic treatment, try to restore the leg, and the outcome was better than the surgical leg. But nonetheless, she had to spend a lot of money to get that problem resolved, and it was a veterinary-induced problem. But if we can stand up and be honest about things, then we can make a decision about should we risk doing it. Well, I'll tell you after that, she's like, that's it. I'm never giving a rabies vaccine to a single one or another one. I don't care. None of my dogs. That's it. I'm done. And I said, I get it. I hear you. No problem. I'm right here for you, because I would have written her a letter I had done years prior. And
Yeah.
again, she was just worried, and I understand, and I do within reason what a client asked me to do, and he had been doing
Right.
well. His name was Joe. But anyway, go ahead, Joseph.
It's just amazing to me, some of the things that we accept for our animals because a veterinarian has told us, and because there's a sort of a disconnect in what is okay for an animal and what is okay for a human. For example, if somebody came, I don't know a single person on the planet, if somebody came to them and said, we know you go hiking a lot in the mountains and you get bit by mosquitoes all the time. If you take this pill and eat it for 6 months, you'll never get bit by another mosquito again. Every human on the planet would go, no. What? It's going to go through my bloodstream, and then every time something bites me, it'll die? None of us would do it. But
Mhm.
somehow we just go, oh, the vet said, so it must be safe, and it's convenient for me, so I do it. But when we put
Well,
it
when
in
we think
terms like
about our pets are our children, and there's a little
absolutely
feeling that goes into that. When we're deciding things for ourselves, we feel responsible for it. We're making it responsible. When we feel responsible for our fur family, our four-leggeds, two-legged, feathered friends, whatever, then
slithering.
I understand we kind of come and feel a little bit more vulnerable. The veterinarians say, "Oh, this is a good idea to put this." They're not going to say it this way: poison in your pet's system
Right.
that is going to stay in the system for a long time, or continue to give it every month after month. It'll kill all this stuff, and isn't going to be much better for your pet. You feel this obligation. Oh, my dog can't make the decision to do what's best for or I would do
Right.
what's best. We all want to do what's best. I understand that, but we do have to step up and make bigger, responsible decisions, because they are being recommended by veterinarians, from surgery, dental, vaccinations, and drug treatments. These things, sometimes it's really okay in these things. You still
Yep.
love and care about your pet, and under
Absolutely.
no circumstance ever should you be shamed about refusing particular treatment. And if you are at the wrong vet,
Yeah.
period. We should be able to dialogue and speak with you, and we could be past something, but under no circumstance, well, you're a bad pet owner if you're not going to take this flea and tick poison, or you're not going to get this vaccination done, or you're at the wrong place. Find somewhere else. Even if you do want vaccinations, go find somewhere else, because that person is not going to stand when an adverse event happens, and you go back
Right.
to that veterinarian. They're going to vehemently had nothing to do with it. You're not going to get the support you need. You need a veterinarian that's going to listen to answer your questions, not get defensive, and be able to logically and rationally discuss the pros and cons of what's purged. And if that can't
Yeah.
be done, no offense, run fast,
Run.
run
No
fast.
offense taken. I agree. I experienced it. I really never have to take my dogs in or my cats into the veterinarian, but I had to go to the emergency room. It was 9 o'clock at night, of course, and
Of course.
so I took her, and it's crazy how bully. I don't know if bully is the right word, but when I made the decision to not let her do the surgery, it
Mhm.
things switched really quick into this needs to be done first thing in the morning. Vets are very busy right now. They're probably not going to get you in. All this stuff just started becoming this like urgency that wasn't there before. And now it's like, you have to do it
Right.
now. And, and even I was like sitting there just going, oh my, oh my God, like how bad. I mean, and to be fair, and I love my husband, no offense, it is not good to have the person's the most emotionally attached to that animal sitting in the car just panicking. Like, I'm like, he's gonna give them the deed to our house right now.
Yeah.
Like I just I've got that's his baby. I mean, he is just
Yeah.
he is so in love with these cats that he's not used to seeing blood, and he's like, oh, she's bleeding from the eye, and da, da, da. Just like between the two of them, I was like ready to just peel out of there. But you definitely have to, it's almost, I hate to say it, but in a weird way, it's like buying a car. You need to just walk away for a minute. Just walk away from the situation. You can always go back, but just be able to say, you know what, I need a minute. I just want to go sit and talk by myself and figure out what I want to do. But that urgency they put on you is, it's just,
I
it's
want
not
to
good.
I want to speak to that because this is a very common thing and it makes listeners quite a bit. I think one of the areas that is a complete panic, and they do this in human medicine too, so there might be some value in listening to me on this. If your pet gets diagnosed with cancer, I promise your pet didn't get cancer yesterday. This has been something that has been progressing or brewing for some period of time, weeks, months, or years. And when you get pressured, we have to hurry up and cut things out, cut things off. We got to hurry up and do
Chemo today.
chemotherapy. Today
Today,
we have
got
to
to
start
start.
right away, immediately. We can't wait. Remember, take a breath, step away, like Carrie said. Take a breath. Think about all your options. Maybe you want to consult with a homeopathic holistic veterinarian. Because once you go
Hopefully.
down that path of cutting things off, cutting things out, there's minor exceptions. I mean, if your pet is bleeding internally and is going to pass away, you do what you've got to do. And then
Yeah.
go see, hopefully, a homeopathic holistic veterinarian to help healing process and to help hopefully improve or lengthen the quality of life for the pet, because anything they offer as far as chemo, radiation, and remember, in animals, radiation means anesthesia for every single radiation event. And so if the pet is getting radiation like every day for 2 weeks, they get
Yeah.
anesthetized every day for 2 weeks or twice a day for 2 weeks. That anesthesia alone is an immune depressant. If we understand cancer is abnormal tissue growth gone out of control, that's a failure of the immune to be able to notice that you have abnormal cell growth. And it doesn't go and, hey, you don't belong here. You're a cancerous cell. You're not a healthy looking cell. I'm going to eradicate you. So the immune system, the whole body has failed to recognize that. Do you really think your pet's immune system is going to be enhanced by anesthesia, radiation, chemotherapy, whatever? I'm not here to tell people if you have cancer, don't get chemotherapy, but I'm asking you to think. And you have time to think about things. You have time to make decisions. You have time to research. Do that. In 99.9% of the cases, you absolutely have time. And please
Yeah.
understand that that disease did not occur instantaneously. And in Carrie's case with the kitten, let's say this was a trauma that exacerbated an unresolved um, traumatic incident that had occurred, sometime prior. She still has time to be able to sort through that and decide how she's going to proceed with treatment. And as long as the bleeding stops and the swelling is starting to go down, then the danger is beginning to most likely, more likely than not, is beginning to pass. And so it's really scary to see things in
Yeah.
blood and discharges and things like that, even ear discharges or blood from the ear with ear infections. It's always a good idea to get things checked out, but it's okay to take a deep breath. Don't get pressured. Follow your gut. Listen to what they're saying, see what makes sense, see what doesn't make sense, and say, you know what, I think I'd really like to follow up and get in touch with my veterinarian tomorrow, like Carrie did. That gives you the time to not make a big mistake, like a big surgery and a big anesthesia.
Yeah. I really felt for people when I drove off of that emergency room parking lot that I sat in for 4 hours. But when I
Mm.
drove away, I just thought, God, these poor pet parents. I mean, I just saw all the cars lined up and I thought, how many animals are in there right now getting treatment that they shouldn't maybe be getting, or that parents are making decisions based on, just being scared and being thrown in that. For me, to be honest, thank God my husband's not listening to this. I didn't even want to take her to the emergency room. I really didn't. I really thought, let's give it a minute. But there
You
was that other
heathen,
emotion
you
side where I thought,
heathen.
well, if I would have made the wrong choice and something happened to that cat, we'd be in divorce court right now. Like he's just like he's like, well, what do you think? And I'm saying, I think let's just give it some time. Like let's just give her a minute. And he just so you have to kind of put all that stuff together or what's going on. I should have taken more control over it because I don't think I would have taken her had he not been home that night. Like I just don't.
Well,
But
it depends on what unfolds because, like I said, if the bleeding subsides and the swelling goes down, it might be appropriate to just go and see your vet in the morning. If you're
yeah,
not sure, it's okay to go to the emergency room. You just want to dictate what happens at the emergency
yeah,
room and not
it's
get
so
pressured,
hard now
being
when they won't let
alarmed.
you in and you don't. It's just I
That's
can't
very
believe they're still not
difficult.
letting you in.
It's very difficult. And my
Yeah,
French Bulldogs decided to have her eye pop out on a Friday evening because it's such a good time for that to happen. And I don't do
yeah,
surgery anymore. So I had to rush her to the 24-hour emergency service. And well, anyway, even with my veterinary discount, $2,000 later to have her eye removed, it was
wow,
curbside and it was horrible. I mean, they were jerks. They
horrible.
wouldn't take my homeopathic medicine. And at least I administered it to her right away when I picked her up the next morning. And she did
Yeah,
great. But the interesting thing was that even though her eye was popped out of the socket, she didn't appear painful. Now, you and I would think, oh my gosh, that's got to be really painful, right? It just has to be. Well, I
yeah,
lubricated her eye really quickly because it's sticking out, so she can't lubricate it with her eyelids. And I gave her homeopathic arnica, which is really good for trauma and pain. And I said, it must be traumatic. We have no idea how it happened. But she never showed any signs of pain. She was a little bit like, oh, this feels weird, and wanted to swipe at her eye a few times
this
with her paw.
feels
So I
weird.
kept her from doing that. And but she just didn't really act painful. She's like, oh, cool. She's looking out the window with the only good eye, and the other one was pretty useless and non-visual. But they said to me, oh, we could put her on heavy duty pain medication. I said, whoa, hold the phone here for a minute. No, 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 no. No. And I said, okay, when you're going to do surgery, it's okay to use pain medication. Then after the surgery, you can use some pain medication. And I wouldn't let them use antibiotics. I said, this is not an infection. There is no
Yeah.
indication. One time, can I? I said, no. She has
Oh,
chronic inflammatory bowel disease and urine and fecal incontinence, and she'll be hosing diarrhea, like worse
yeah.
than ever. And I said, so no, not even one injection pill, not nothing at all. No, you can give her pain medication, anesthesia, obviously remove the eye. And then I did submit pathology and it was totally normal. So for some
Mm.
reason, she decided she didn't need the one eye. I don't know. So can't figure that out. But when you bring your pets and your pet is in terrible pain, I want you to look at your pet and don't necessarily agree to heavy duty pain medication if the pet is not showing evidence of pain. You know your pet better than anyone else does. And because something looks like it should be painful, and logically you'd say it really must be painful, doesn't necessarily mean it is. But I will say, too, I don't want you to feel like I'm a terrible person. Arnica does help immensely with pain from trauma. So it wasn't that she had nothing for pain, but they wouldn't take my medication to manage her pain. So I allowed them to give the pain medication at the hospital, and then they fought with me about putting her on gabapentin. It's the new, latest, greatest pain medication that veterinarians inappropriately use. It's a neuropathy drug. It's used for neuropathic pain. It's not used for any old garden variety kind of pain, a little toothache or this or that. It's not used for that. It's a
Yeah.
neuropathic pain. It's used for people who have nerve pain. And it's overused in the veterinary world. And I said, no, she's wobbly in her hind end and she'll be so drugged up and gorked she won't even be able to walk. Yes, but it's indicated because she has a weak hind end. I said, she's had that all of her life. It's a little worse because she's getting older, but she's had it all of her life. So
So
gabapentin is not going to give her a new spine. She has a congenitally damaged spine
yeah.
and it will not fix her spine and not in pain with it. She runs across my yard with her two little stick legs together, and is almost faster than I am.
So
So she's
she's
not in pain. So be careful too when trying to convince you, oh, but your dog needs this really strong pain medication, and you're thinking to yourself, my dog just doesn't seem like they're in pain.
yeah.
So
Yeah.
take the medication and don't give it then. I don't
Yeah.
know, but I just be careful
I
because
just did that. I'm guilty of that. I'm guilty because I didn't want to fight. But
uh,
then at the same time, I'm mad at myself because I
well,
paid
take it and
for.
don't use it. Yeah, if you want. I mean,
I
it's a
know,
waste
but then I
of money.
paid for it because I was a big chicken shit to say I don't want it. I was like, fine, whatever. Take my $60, and then I, of course, never gave it to my dog. But I was like, why
They
am
were
I not?
begging me to go home with gabapentin. And I said,
Yeah,
no, They said, well, we'll give you a few pills to get some. No, I don't need it. If I want it, I'll get it on my own. Thank you. I'm a vet. I could get it if I want. I don't have that drug in my office. I have never had to use it on a single pet that I've ever seen. Now,
That's
granted,
amazing.
I don't see hit by car dogs all the time or something like that, but that's not necessarily indicated for gabapentin either. So just be careful, and if you're able to, find out the side effects, medications, etc. So
yeah, definitely got to know the side effects. They don't tell you. They just say this is safe.
You know what? Dr. Google works really well for that. So you can Google anything. Just go online, even in the parking lot on your phone, and just Google that. Can you spell that medication for me? Just Google it and read the side effects. Why not?
Yeah.
What's it going to hurt?
Speaking of which, Coco, I don't know if you're still there, but two things. One, I would check all the side effects if your dog is taking any medications, and see if those have been some side effects of licking, of air licking. And two, if you're back on here, we're here every week. Dr. Canizero hopefully will be back soon, but I am on every single week.
I think I'm back next week.
You are?
I think you bring me into next week, so you get me next week too.
That's awesome. Lori helps. Thank God. Lori behind the scenes. I can't do this without her. But Coco, I would really, and I'm sure Dr. Canizero would really, if you're still there, like to know if you ever find out what that is. It just helps get in our little repertoire of, hey, we know this dog that had this, and maybe this was the case. So if you're still there, keep us updated on your pups, treatment or what ends up happening if you find that out. Dr. Canizero, I'm going to let
more questions.
What?
If you have more questions, feel free to ask more questions as well.
Yeah. I'm going to let you go because I've already kept you 20 minutes past the time I promised to keep you. But thank you so much. And I always look forward to doing these with you. It's so enlightening, and you're just such a ray of help and sunshine. And I just love it. I just absolutely love it. Thank you so much. I know we talked a lot about my cat. This isn't Carrie's Corner about her animals, but I wanted to let you
call me about your cat.
Yeah, I should. I'd have to send you some stuff and figure out if I can put her on something. But I use those stories because I want people to know that even someone who's been working with animals for 37 years, I still find myself in the same situations as you do. So don't beat yourself up when you make the wrong decisions. Like Dr. Canizero said, I shouldn't have given her the antibiotic. I let them do that. So don't beat yourself up when you make those wrong decisions, but try to educate yourself as much as you can and be emotionally ready to step away for a little bit. I think that's the gist of tonight, is to be able to walk away. Like Dr. Canizero said, it's very, very rare that you need to make the decision right here, right now, this second. So give yourself some time, sit back. We're here every Wednesday, so there's always that. Something happens on a Wednesday afternoon, know that we're going to be on at 4:00. So we might be able to kind of guide you a little bit. Lori, thank you so much for helping in the background. I know she's off, but she can hear me. So I just want to thank her. She's the one that's giving you guys all of the writing and everything that you need. So you can contact Dr. Canizero, who can do consultations for you. And again, Dr. Canizero, thank you so, so very much. We all really, really appreciate it.
Absolutely my pleasure. And I'm looking forward. We'll work with one of your pets, and then you can have a real life discussion about what your experience is with homeopathy. But I want to thank everybody for joining us too, because, knowledge is power, and just understand that you only know what you know when you know it. And so it's incredibly important to be kind to yourself, because this is a process for all of us, including myself. It's a constant learning experience, because I never stop learning. And not that I learned from Carrie, I learned from a lot of people, but I also learned from the experiences, and I learned from my clients. And I learned how to be not only a better pet parent, but also a better veterinarian, a better listener, a better person. So be kind to yourselves, because if I know one thing for sure, I know that you don't join a podcast like this if you aren't absolutely mad about your pet. I just know it. I mean, I know I'm mad about mine. You want to see my one? Here's my one eye.
Yeah. Carol, I wish I would have known you were there. I have a client who's listening who has the cutest little puppy. It's not a puppy anymore, but hey, buddy.
This is Chloe, my one-eyed girl.
She's the
Chloe?
one-eyed girl.
Yes. She's not giving you her
French
one eye.
bulldogs.
Let's give you, here's her one eye.
She's like, I don't need it. I didn't need it.
But I don't need it. I got rid of it. One is good enough. She said, I'm a cute Cyclops. He says, I don't mind.
I will tell you one quick little, I don't know if I should share this story, but I'm going to tell you this real cute. It's not a cute story. Please don't anybody beat me up for telling you this story. But years ago, years and years and years ago, a groomer was grooming a dog, and she was kind of new at it and pulled the head, like she was trying to do something, and she kind of grabbed the hair, and the eye popped out of the Shih Tzu, and she panicked. Yeah, so she panicked, and it didn't come all, it didn't and she panicked. I wasn't there, and she, I guess, popped it back into the socket. And then she's telling me this story later. This is back, years ago, back when I was a vet tech. She's telling me the story about it, and she's like, "Oh my God, I didn't know what to do. So I popped it back in," and she's still kind of shaking and in a panic. And I go, "Well, did you pop it back in right side up?" She goes, "What?" The look on her face, I go, I'm kidding. I'm just kidding. She's like, "Don't do that." I've never ever forgot that, because it was just kind of, but the dog ended up, thank God, being fine, and everything went back to normal. But yeah, you got to be careful. Some of these eyes, Shih Tzus and these guys. So. But anyway, I probably shouldn't have ended on that story, except that the dog was fine. But I am going to say goodnight to all of you guys. So I actually got to go pick up a dog at a vet hospital right now. So I am going to let you guys go. Dr. Candace,
it better not be yours.
It's
not. Better not be one of yours.
It's not. It's not. I have a client who just had a baby. She just had a baby. She's got and she needs to get her dog from the vet. I told her I'd do it for her. So I'm going to go pick her dog up.
So sweet.
Yeah. Well, her dog is precious.
Pebbles is saying hi to you.
Good night, sweetheart. I swear I'm going to come work at your place for at least a week.
You have to. I'm counting on it.
I
would have brought my horses in here too, but that was a little hard, so I couldn't do that.
I want to go live on your farm and work there, and I don't know. So, all right, everybody, I'm going to let you go.
Hurry up and come. Thank you, everybody, so much, and I really, really, really appreciate everybody, and I appreciate you, Lori and Carrie. Thank you so much for having me.
I'll see you soon. Happy birthday again, belated.
Oh, thank you. I know that's it's one of those bigger ones.
Oh, really? I have one coming up in 2 weeks. Mine's coming up, so, and all of mine are bigger ones now. All of mine are big.
Well, mine are probably only getting bigger.
I just feel like, I made it another year.
Yep, I made it another year. Woo!
Yeah. So all right, good night, everybody.
Carrie, you get in touch with me. Thank you so much. Thank you, everybody.
Good night, everybody. Bye.
Good night.